first we'll start by scanning the room. And now I'll begin my head to toe assessment.
Come in.
Hi, my name's Jade. I'll be your nurse today. I'm just going to wash my hands and close the door for your privacy. Are you in any pain today?
No.
And do you have any allergies I should be aware of?
No.
Can I see your wristband? Can you state your first, last name, and your date of birth?
Madeline Williams, 1996, October 16th.
Patient looks her stated age. There's no foul odor or anything coming from her. Overall hygiene looks good. Do you know where you are?
University of Detroit Mercy,
And do you know the year?
2016.
Okay. Patient is alert and oriented ×3. There's no obvious signs of illness. Okay. And now I'm going to feel on your head. Is that okay?
Yeah.
There's no lesions or masses on the head. The skin color looks good for ethnicity. There's no moles or abnormalities. If there was, I would use the ABCDE assessment tool to assess them. Okay, now I'm going to look at your eyes. All right, her pupils are round and equal at 3 millimeters bilaterally. And just look at me. Just follow my pen. All right, and the patient's eyes react and accommodate to light well. And now I'm going to look in your mouth. Can you open your mouth for me? Stick your tongue out, say ah. Okay. And her mucosa is pink and moist. The tongue is pink and moist. The uvula is midline and mobile. All teeth are present, straight and white. There's no dentistry work. There's no edema within the gums either. Okay, and now I'm going to move on to your upper extremities, your arms. So if you could just stick them out for me. Just going to take a look. All right, skin color looks good for ethnicity, which I already stated. There's no moles. There's no lesions or scars noted. Temperature is warm. And now I'm going to feel your pulses. Your brachial pulses are equal bilaterally at a 2+. And her radial pulses are equal bilaterally at a 2+. Now I'm going to go back up to your neck, and I'm just going to feel your carotid pulses. And her carotid pulses are equal bilaterally at a 2+. And I'm going to listen with the bell. Can you hold your breath for me? Okay. And there's no bruise noted. Okay, now back down to your arms. Can you put your hands like this for me? All right. There's no clubbing noticed within the nails, and put your and just grasp my hands for me. All right. Patient strength in both of her arms are equal, and then just see your nails real quick. And capillary refill is less than 3 seconds. Okay. And now I'm going to move down to your heart, and I'm going to listen in 5 different spots. I'm going to start at your aortic, which is the second intercostal space. And then over to the pulmonic, which is the second intercostal space. And then our herbs spot, which is the third intercostal space. Tricuspid, which is the fourth intercostal space. And then down here at her mitral, which is the fifth intercostal space, left midclavicular line. And I would listen there for 1 minute for her apical rate. And now I'm going to listen to your lung sounds, 10 spots in the front, 10 spots in the back. You just take a deep breath in for me. And then another one. and her lungs sound good. Anterior, there's no adventitious sounds. Now, if you could just turn around so I could do the back. All right, and then a couple of deep breaths when you feel my stethoscope. And then you can breathe normally. And there's no adventitious sounds heard there either. Now, could you just stand up for me for a second? All right, and just bend over just a little bit. I'm just going to feel your spine. All right, you can stand back up. The spine is straight. There's no curvature noted, which means there's no scoliosis to be concerned about. Now, I'm going to percuss over your lower back. Just let me know if you feel any tenderness. Anything?
No.
Anything there? Okay. And now you can sit down, and now I'm going to be looking at your abdomen, so you can lay down for me. All right, can I pull up your shirt?
Yeah.
Okay. First, I'm going to be inspecting. The skin color looks good for ethnicity. There's no moles, lesions, or scars, and if there was any moles or abnormalities, I would use the ABCDE assessment tool again, but there isn't any of that. And now I'm just going to be listening. Sorry if the stethoscope's cold. And there are bowel sounds present in all four quadrants, but they aren't hyper or hypoactive. And now I'm going to state the organs that are in each quadrant. In the left upper quadrant, there is the stomach and the spleen. In the lower left quadrant, there is the left ovary and the left ureter. In the upper right quadrant, there is the liver and the gallbladder. And in the right lower quadrant, there's the left ovary and the right ovary and the right ureter. Okay. And now I'm going to be percussing, so let me know if you feel any pain or anything. All right. And there's tympany felt or heard over all quadrants except for above the liver. There's dullness heard. And now I'm just going to be palpating, pushing down a little harder, so let me know if you feel anything. Anything?
No.
Okay, and there's no tenderness there, so I'm just going to push it down, and then you can sit up for me. All right, and at 45 degrees, her JVD was not present. Okay, so now I'm going to be looking at your lower extremity, so if you could just pull up your leggings for me a little bit. The skin is warm, there are no lesions or scars, skin color looks good for ethnicity. There isn't much hair, but the patient says she's shaved, so that's probably why. And I'm going to be feeling for your pulses. Her popliteal pulses are equal bilaterally at a 2+. Her dorsalis pedis pulses are equal bilaterally at a 2+. And her tibial pulses are equal bilaterally at a 2+, and there was no edema noted within the lower extremities. Okay, now I'm going to perform the Babinski test. Yeah, you can pull your pants down.
Okay.
Alright, so I'm just gonna Alright, right, and there was no flaring of the toes there, which means she passed. Now, if you could stand up for me. All right, now we're going to perform the Romberg test, so I just need you to close your eyes. I'm going to be here right behind you. Make sure you don't fall. I'm just going to check for any swaying or anything. All right, the patient is not showing any swaying. She's standing good, not falling down, so she passes. Okay, and now we're going to have you perform the Get Up and Go test. So if you could just sit down and then get up, walk a couple feet, then come back and sit down again. Patient's gait is good and steady. There was no swaying, and she looked steady. And that concludes my head to toe.